groups. This is not only about cardiologists, this is about everyone involved in acute cardiovascular care. Actually, the best quality is provided by systems like the STEMI networks. Now we need acute coronary syndrome network for non-STs, cardiac arrest. So we believe in systems, and for that we need incorporation between professionals. We believe in communication, in exchange and cooperation between different groups. This is not only about cardiologists, this is about everyone involved in acute cardiovascular care.
It's a transversal association which takes care of the patients before the hospital, in-hospital phase, and until the out of hospital at the discharge of the patients.
The ACCA is a really big and fast-growing community. There's a lot of different physicians and scientists from all areas of cardiovascular care and acute cardiovascular care. So one of the main goals of the ACCA could be to facilitate translational research and to bring together clinicians and scientists in order to improve patient care in patients with acute cardiovascular disease.
With the help and with the backup of a bigger association like the ACCA, we have more leverage within our country, from the small community working on acute cardiovascular care to educate our physicians, to give them incentives to improve the care of patients, to improve the diagnosis of patients, and to disseminate knowledge and guidelines.
It's one of the important aims of the group to disseminate knowledge about the appropriate use of biomarkers, but also to really identify the knowledge gaps and also suggest how we should overcome these gaps. What kind of studies do we really need now?
It's a very, very important innovation by the European Society of Cardiology. It begins to put structure into an area where we haven't had a lot of structure before, and with it there's a major biomarker effort that is part of it. And what it allows, I think, will be much more visibility for the effort, many more resources, and the ability then to move the field much more rapidly.
For the next 5-10 years, we have a lot of challenges. Challenges we are planning to face through education of our members, because indeed we are entering the era of intensive care where we have a lot of partners. And that we will do through the ESCEL platform, a learning platform. We have also the textbook, where we have a lot of input of people working in other areas, very close affiliated to ours, so being intensive care.
The role of ACCA will be essential to exactly monitor what goes on in the different countries. Because before taking decisions or telling people what they should do, we first have to know what they actually do. And I think there is a huge role for ACCA to try and monitor the actual practice in the different European countries and to form the basis for reasoning and afterwards trying to select the best options for the patients.
The acute cardiovascular care medicine is a highly interesting field because it includes many subspecialties and many topics, and because many changes are going on in this field. ACCA is very interested in having young people aboard, and education is one major tool of the association.